Casey, so you've recently been diagnosed with diabetes type 2. So there's just a couple of things that I need to talk to you about, especially with your feet. Have you noticed any changes in sensation with your feet?
Sometimes maybe.
Okay. Well, I just want to teach you today about how to do a foot exam so you can check, because with your decreased sensation, you're at risk for developing wounds, and we just want to make sure that you know the signs and symptoms of having a wound and preventing infection. So the first thing I noticed is that you're wearing flip-flops.
Yes.
And
It's summer.
even though I am also wearing flip-flops, it's not the best choice of footwear for someone like you. So when it comes to proper footwear, I want you to make sure that it's a well-fitting shoe, and anything with laces is going to be a little bit better so that it can form to your foot. And I want you to always be wearing clean white socks. And I don't want you to be walking around barefoot, because if you step on something sharp and you start to bleed and you can't feel it, it's not a good plan. So, first of all, I want you to put your foot up like this, if you can. Yep, great. Oh, good for you. I want you to make sure you're always checking in between your toes. And I want you, if you are having trouble seeing the bottom of your foot, you can always use a handheld mirror to kind of see all the way around. And if your family members have foot fetishes, they can look at your feet too.
That's great.
The next thing I want to talk to you about is things to watch out for. If you ever notice any blisters, any sores, calluses, anything like that, you just got to kind of be aware of it. I want you to make sure that you are washing your feet well every day. Make sure that you dry them also. If you ever notice any calluses, like I said, you can use lotions to treat your dry skin. I never want you to treat corns, calluses, or toenails with sharp instruments. Just because
no toenail clippers?
I would recommend keeping your toenails just a little bit longer than you might be used to, just so you're not cutting it close to the skin. Sound okay? All right. And yeah, one more thing is cut your toenails straight across when you do that. So, is that things you think you can remember for me?
I think so.
Great. Well, it was wonderful to meet you, Casey, and if you have any problems in the future, be sure to let me know.
Okay.
Bye-bye.